Hello, everyone. Welcome back. Once again, I am joined by Dr. Ryan Mekota. Hi, Dr. Mekota. How are you?
Good. How are you doing?
Good, good. Dr. Mekota is a clinical neuropsychologist at PBHS, and one of the patient populations that he works with is our senior citizen population. So, Dr. Mekota, our first question to you is really if you would be able to provide us anything we should be listening for when we cannot see our older adult family members or friends.
Sure. Yeah, there are a number of things I think we can listen for, and yeah, you're right. These are some unique times, and we often can't visit maybe the way we're used to, and check in the same way. So maybe often more times relying on the phone. So first, I'd want to know: are they completely isolated? Does our mom or grandmother have as a grandpa, a spouse that's with them, staying with them? That already makes it, better for them. The more social support around them, the better as far as, you know, uh, vulnerability for depression and things like that. But when we're talking on the phone, I often simply would recommend coming out and ask, how are you? How are they doing? And we often say fine, good, but maybe asking follow up to that as well. Um, and things to listen for, of course, like saying they're tired a lot or they're sad or lonely. Can be some red flags. Also, listen for the intonation in their speech. So, does it seem like their speech normally have the normal ups and downs, and now it's just kind of flat, monotone? When things kind of flatten out and slow down, that can sometimes be a sign of depression. So also checking, in with them about what they're doing to keep their day full. If it's, I'm sleeping, they're telling you sleeping more like 12 hours a day when it used to be 8 or 9, often taking naps, just watching TV, then again, depression. We look out for a lot of these signs for depression that can come on when we're more and more isolated and more restricted in what we're doing. So, other than depression, as we get older, we're more risk of stroke. If we have a loved one who has a history of vascular kind of heart disease or things like that, more risk of stroke. And of course, you have that with age, the risk increases. So also looking for things like slurring in their speech, checking in if they have numbness, tingling anywhere, if their speech becomes confused or garbled. Those can be signs of if they're having a stroke or had some kind of cerebrovascular event, or like a stroke or a mini stroke or TIA. So those are some things regarding, depression being a risk we want to look out for, as well as other things like strokes that we can just listen for simply over the phone and kind of check in on.
Excellent. Now, how about advice? If you feel that you are picking up on something over the phone where your loved one does not sound the same, what kind of advice or measures would we be able to take to provide them without being really physically in contact with them?
Sure. I would suggest that you maybe making more of a scheduled, regular, daily check-in, to have our ears closer to the ground with how they're doing. So if you're used to checking in once a week or visiting once a week, consider calling every day and making it a part of the day. Also, uh, soliciting the support if you have any other siblings or other loved ones that can also call in, check in, and provide, some social support that way. Definitely do so. Kind of get everybody stirred up and supporting each other. Also, develop ways that they can, help foster some routines and structure and movement, some kind of activity. Doesn't because of what we're going through doesn't necessarily mean you have to do nothing. That you can't at all step outside your door. What things are safe. Certainly, if they're in a densely populated urban area, want to be careful how much they're outside. But if you feel like they can safely, traipse around outdoors and on the sidewalk safely, then encourage a little bit of short walks, or simply even getting out, sitting on the porch, when the days are nicer, etc. It depends on the level of functioning, of course, that our older adult loved ones have at any point in time. Also, you know, a lot of places, PBHS included, continue to have services available. You can call in, do everything remotely through what we're doing or through just telephone. And we can have, in addition to maybe what you might be doing to check in and do what you can to support, our older loved ones, we can have trained professionals check in and get them involved with some kind of telehealth therapy or even some medication management if that's necessary.
Perfect. Thank you very much. It's always very nice to see you. Hopefully you're staying safe.
Absolutely.
Oh, good. All
Down here in
right.
my basement, hunkered down.
Oh, we can tell. All right. Well, thank you very much, Dr. Mekota. As always, thank you everyone for watching. If you have a question for Dr. Mekota or any of our other providers, please feel free to send us a private message. And above all, as was mentioned, if you or a loved one are struggling, please feel free to contact us or any other provider. We have some wonderful resources in our area, and everybody has really mobilized to provide these telehealth services. So thank you very much once again, and thank you all for watching.